I'm going to tell you a story that's crazy but true of how I used a yellow highlighter to cure cancer in my father-in-law, and then I'll tell you how it's related to tailbone pain. I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in New Jersey. And about 20 years ago, shortly after I first got married, we got a phone call from my wife's family in the Midwest, Chicago area, that my father-in-law, who was in the hospital in Chicago, was a former Notre Dame football player, and unfortunately, they saw on his imaging studies that what looked to be a cancer in his lungs. And it was actually pretty clear that it was looked pretty bad, pretty destructive, and it showed up incidentally on some imaging studies that he had done while he was in the hospital, and for something unrelated. And the plan was for him to have a biopsy where they would basically make a small surgical incision in the skin, and they would go in with take a sample of tissue so that they could send it to the pathology to do slides, to take a look and figure out exactly what type of cancer it was and all of that. And he told them at the hospital, he said, well, you know what, my son-in-law is a doctor, he's in New Jersey, and my daughter is there. Can you fax them a copy of the imaging results? And the hospital did. Now, what I did when I got the imaging results was the exact same thing I pretty much always do when I get imaging results, which is I take a yellow highlighter and I highlight the important factors in the report. And it's something I've been training medical students and resident physicians. It's incredibly simple, right? It's not, rocket science. And the very first thing that I typically always highlight is the patient name. So I get the fax and I highlight the patient name, but it's not his name. It wasn't his imaging result. And it turned out that somehow someone else's report got mixed up into his chart, and they were planning this whole diagnostic workup. The family was, of course, in a whole kerfluffle about worried that he had cancer, when indeed he had no cancer at all. It was somebody else's report that happened to make it into his chart, and apparently the medical team there hadn't noticed, and they thought it was his, so they were, consulting other doctors to do the biopsy and everything else. And so that was basically a very, very simple step of using a yellow highlighter to, you could sort of say, cure cancer, at least in his case, that he, was thought to have cancer, and with one stroke of a yellow highlighter, no longer had cancer when we called the team out there and got that all straightened out. Now, how is this related to tailbone pain, which is what I treat? I'm the director of the Coccyx Pain Center, or Tailbone Pain Center, here in New Jersey, online at tailbonedoctor.com. And it's related to tailbone pain because patients come in to see me from all over the country and occasionally internationally, and we typically, tell them to bring with them any reports that they have from previous imaging studies that they've had of the tailbone, procedures they've had from surgeries or injections at the tailbone. But even for patients who can't make their way, here to New Jersey to see me in person, my recommendation would be collect your medical records, your radiology reports from your x-rays, your MRIs, your CT scans, bone scans, whatever studies you may have had done, and take a simple yellow highlighter. And what I recommend is that you highlight, number one, your name to make sure that it's actually your report, the date for when it was done, and highlight if your main symptom is coccyx pain or tailbone pain, highlight the word coccyx or tailbone or coccygeal anytime that appears in the report. And I guarantee many of you will be shocked to find out that your X-ray report or your MRI or CT report never even includes the word coccyx or tailbone, that the radiologist never made any comment whatsoever on the appearance of your coccyx, the appearance of your tailbone. And even though that was the presenting symptom, the main reason that you went in for the evaluation in the first place. I know that probably sounds really crazy, but I see this practically every single day here at the Coccyx Pain Center when patients come in, and we look through their reports, and they're shocked to realize they've had this pain going on for years and years. They had the imaging studies done years ago. They were told everything was normal, and in fact the radiologist never actually looked at the tailbone at all, and often the imaging studies never even included the tailbone at all. It was done of the lumbar spine. So it's a really, really simple tip that often can pay big dividends because you can then go back to your doctor and say, hey, you know what, the imaging studies that were done for my tailbone, did they even include the coccyx? The radiologist didn't make any comment on it. Or the physical exam notes from the physician never included documentation of a physical exam of the coccyx. Or the procedure note shows that the procedure that was done was an injection at the lumbar epidural space, or at the sacroiliac joint, or a caudal epidural, none of which are an injection specifically at the coccyx. So again, many of you will be surprised what you can find out just by reviewing your medical records. Collect your medical records, use a yellow highlighter. Yellow is really good because if you need to make photocopies, the yellow is light enough that you're not going to obscure or blacken out the information that you want. So don't use like a blue or orange highlighter. They're not as good for those purposes. There's a whole chapter in my book, which is Tailbone Pain Relief Now. I have an entire chapter in the back about collecting and how to handle your medical records and navigate the healthcare system, and some of the caveats, some of the hurdles that are in place for people with tailbone pain, because it's often sort of this black box that physicians, radiologists, pain management doctors, musculoskeletal physicians don't pay attention to some of those details. So again, use the yellow highlighter because it can really help you to see what was missed on your imaging studies, or perhaps the imaging studies are not yours at all. Okay, again, I'm Dr. Patrick Foy. Online, you can find me at tailbonedoctor.com, or if you're interested in getting a copy of the book, Tailbone Pain Relief Now, which is 272 pages, all about the tailbone, diagnostic workup, treatment, etc. That is available on Amazon. Is probably the easiest way to find it. If you just put in tailbone and the word Foy, my last name, F as in Frank, O-Y-E, you can find that there. So anyway, hope that's helpful for you. Use your highlighter. You'll find it super helpful. All right, bye-bye.